Here.
Julie Kurtz, live in Washington. Julie, thanks.
Sure. Well, with President Obama now threatening to strip insurance companies of their antitrust exemption, could new regulations make their way into the reform legislation being hammered out in Capitol Hill? Joining us now, our Republican Congressman Todd Akin from the Committee on Small Business and Democratic Congressman John Adler from the Committee of Financial Services. Gentlemen, thank you very much for talking to us. Congressman Akin, Obama's announcement comes after the industry itself goes on that ad blitz saying that health care reform legislation will drive up premiums. He calls the ads deceptive. So what's the deal after all? Will premiums be driven up or not?
Well, certainly, and it depends which version of the bill you're talking about, but it will drive up premiums, particularly the version in the Senate that says that you can buy your insurance after you get sick. Obviously, that's going to make things more expensive. The heart of the question, I suppose, and this is the Republican position, and that is that we really want to hold sacrosanct that relation between doctor and patient. We don't want insurance employees getting in the way of that doctor-patient relationship. But even worse than that, we certainly don't want the monopoly of the federal government getting into that relationship.
Congressman Adler, Texas Congressman Kevin Brady says, and I'm quoting, the Democrats' plan are loaded with new federal mandates and higher taxes on insurance plans, treatments, and equipment, all of which will be passed down to patients. So what do you say to that? Are the Democrats planning to come out and load taxpayers with higher taxes?
Well, Julie, I don't speak for the Democrats. I speak for John Adler and the people of my district, New Jersey. But what I'm hearing from the taxpayers, the small business owners, and the big company owners is they can't handle the rising cost of care throughout my district, throughout the state of New Jersey, and I think throughout the entire country. I'm sure Todd would agree that the premiums have gone up too fast over the last number of years. We've got to get these costs under control. I think the House bill and the Senate bill are trying to do that. I don't think they do a very good job containing costs. And frankly, we've got to get a handle on these costs because businesses and taxpayers just can't afford more of the same.
Congressman Akin, do you agree?
Well, certainly the costs are too high. Somebody commented one time that if you think health care is expensive now, wait till it's free. Now, there are certain ways to deal with that. One of the ideas is to allow people to sell health insurance across state lines. That'll tend to break up monopoly kind of situations. Right. Another way to control costs is to deal with tort reform.
Let's talk about the Republican alternative, and that would allow the selling of insurance across state lines, and it would have the effect of increasing competition. Some say that's a good thing, but Congressman Akin, I mean, you lead the Republican Study Committee's one-hour floor speeches every week, and the majority isn't considering the Republican alternative. Why do you think that is?
Well, there has been a lot more polarization in Congress this year than usual, and for some reason the Pelosi and her leadership doesn't seem to like that idea of allowing insurance to be sold across state lines. I think it would be particularly effective if you've got a city, for instance, that's in several different states, and then people that are in that city could price shop across the state line. I think it's unlikely, for instance, that someone, for instance, an insurer in Massachusetts is going to be selling insurance into Missouri, but where you have a provider network, you could do that. For instance, in our state, Kansas City, which is half in Missouri and half in Kansas.
President Obama and Speaker Pelosi are also demanding Congress immediately pass this sweeping government takeover of America's healthcare system and the nearly 20% of the nation's economy it represents. But Congressman Adler, do you believe they've even bothered to check doctors and patients about how they might feel about bureaucrats getting in between them?
Well, I think a lot of patients and many doctors around the country are very frustrated when they're told by an insurance adjuster or told by somebody from Medicare, you can't provide this service, you can't do this test, you can't meet this patient need. And that's a real concern, whether it's a private insurance market, which is very much a defective market, really failing where capitalism does so well most of the time. I think what Todd said a moment ago is right on target. We need to have insurance companies allowed to write policies across state lines, because right now, in my part of New Jersey, in every part of New Jersey, I'm sure in St. Louis as well, there may be 1, 2, at tops 3 insurance companies. That's not what capitalism envisions, and with only a couple insurance carriers, they're keeping prices artificially high, they're providing lousy service to consumers when they need it most, and they're really not meeting the needs of doctors and hospitals. So we have a defective market. I think Todd's idea, which I co-sponsor in the House, is a very good measure that will help use competition to drive down cost in a way that we have to have going forward.
It's interesting. It almost seems like there's some bipartisanship right here on our show for the first time.
Julie,
we should take this to Washington.
If we had no, not for the president. If we had 180 Todds and 250 Johns, we would have a great Congress. We get a lot of problems solved. So, and that's the right ratio, I think.
All right. I'll buy it. All right. Thank you, gentlemen, so much. Congressman John Adler and Todd Akin, thank you very much.
Identical outfits.
See how I bring them together?
Yeah.